Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a quantum edition. This audio podcast is part of a Vortux Gauntlet. This audio podcast as part of a Lobostic sequence, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, I look at sort of the works from I look at works from 2015, and where this works was looking at as looking at sort of the aspects of administration and sort of research aspects of research through a leading social media platform, and where this research poster presentation, the research poster presentation provides sort of reflections, sort of co-founders reflections on the initial 5 years, 5 years between 2009 and 2014, and between 2009 and 2014 in regard to the social media platform, the RPSG, the Renal Patient Support Group. This poster presentation formed as part of a part of a healthcare awareness event in around 2000 and 2014, but also in regard to sort of part of an update in line to some other works in around 2015, and thus was part of the a sort of a special a sort of a special a sort of a special edition in regards to World Kidney Day 2015, and looking at sort of kidney health for all. So a little bit of introduction to, and a little bit of introduction. So CKD, chronic kidney disease, is increasingly recognized, or has been in part recognized as a global public health issue and a main determinant of poor health outcomes. There is compelling evidence and that disadvantaged communities through disadvantaged communities, so for example those from low resource and racial and ethnic minority and minority ethnic communities, and or indigenous and disadvantaged backgrounds, suffer from marked increases in the burden of unrecognized and untreated chronic kidney disease, or CKD. Although the entire populations of some low and middle income countries, some low and middle income countries could be considered disadvantaged. Additional factors prompt a position of extreme disadvantage for certain population groups. For example, those living in some rural areas, some living in rural areas, some amongst sort of the some from where the pediatric or young population is concerned, and those from sort of the elderly background, and those from elderly sort of populations, and in amongst particular forms of CKD, or chronic kidney disease, where females and women are at some disadvantage, and primarily owing to where, for example, the urinary tract of females is shorter than that of of those from male backgrounds, and where women or females are more susceptible to having urinary tract infections, and thus leading into symptomologies that link to chronic kidney disease, or CKD, and or, for example, AKI, acute kidney injury, etc. The fact that even in developed countries, CKDs CKD, chronic kidney disease, has increased, and outcomes suggest that there is much to be learned beyond the traditional risk factors contributing to this irreversible chronic illness or condition, and associated um, the risk factors contributing there are varying risk factors contributed to the irreversible condition and associated complications. In this context, using social media can help to support CKD patients, patients in various manners, however, in various ways. However, at present, there is little formal evidence that highlights how an understanding of social media platforms like Facebook, for example, can raise CKD or chronic kidney disease awareness, and support healthcare professionals and researchers. So the sort of aims in as part of this research poster presentation was as providing CKD or chronic kidney disease example. The aims was to provide an understanding of how the RPSG number one raises CKD awareness for all, and two supports healthcare professionals and researchers, and three, to provide a reflection on the first 5 years between 2009 and 2014 in support of World Kidney Day 2015. So now going into how has social media helped. So before 2005, electronic communication and identifying health information was primarily through brochures, books, leaflets, and emails. For example, social media and especially Facebook had become a sort of a basis over the past few years. At least when I say few years, this poster presentations was from 2015, and so a few years, a few years before 2015, or up to and over sort of in the beginning parts in the beginning parts of the of 90 of in around 1990, between 1990 and 1995. So over several years, with users sort of globally. Social networking sites facilitate maintaining sort of a virtual sort of relationships or associations with contacts from from amongst individuals lives. Retrospectively, in the clinical setting, and through traditional sort of groups, people have helped one another adjust to the experiences of CKD or chronic kidney disease by exchanging emotional, and instrumental forms of support. Informational support, for example, exchange of advice, explanations, research, opinions, and experiences, helps healthcare service users understand and learn, and healthcare service users understand and learn, with and in regard to CKD, chronic kidney disease. And there is literature that looks into sort of the how varying forms of traditional modalities have been and are useful. In contrast, emotional support can strengthen interaction and self-esteem, as well as reduce stress and as well as reduce distress, such as anxiety, concerns, and prompt sort of empathy and provide reassurance. Instrumental support surrounds the exchange of practical assistance, and around practical assistance, and using social media forms. So, for example, forums, chat rooms, message boards, blogs, and online support groups are and have been opening ways in which healthcare service users with CKD, for example, gain supportive insights into aspects of kidney disease or kidney care, and communicate more and communicate more sort of generally. Rapid growth in the acceptance or the use of social media groups have also unbottled sort of unbolted, sorry, a new a novel channel for recipients and the public to interchange vital methods or basis of peer support, and gain perspectives on the importance of disease awareness and involvement in research. So a little bit now going into about the RPSG. So the RPSG is a non-funded social media platform which is and was founded and co-founded in around 2009. Um, um, in around 2009, and the initial intention excuse me, the initial intention of the RPSG founders or co-founders was to help all with CKD, in fact, help all with CKD, and carers following sort of routine appointments. And the RPSG founders investigated an online platform, and investigated sort of online platforms, and Facebook at the time provided a sort of fitting choice as a social media platform recognized on an international recognized sort of internationally, which allowed the sharing of sort of real-time lived experiences. Since the RPSG is mainly or had mainly been a Facebook platform, it lent itself well to raising CKD awareness, allowing members to share real life stories, and inviting research collaborations. Using or utilizing social media also offered opportunity to researchers to researchers and healthcare providers to partner with healthcare service users as never done so before. Unlike other Facebook groups, the RPSG is and has been research proactive, and the again, the RPSG had around 10 or 11 members who'd form the administrative and research team, with representation from the United Kingdom, Europe, Australia, and the United States at the time, whom have been responsible for facilitating and moderating the platform. So now, looking at sort of some of the early RPSG sort of activities. So involvement and interaction activities through the RPSG have provided a great opportunity for discussions about how healthcare service users, professionals, and researchers should and could work in partnership to find answers which could improve sort of lives of those with varying forms of chronic kidney disease or CKD. Being involved also provides potential to become a basis for shared decision making, as increasing circumstantial as increasing circumstantial and sort of more prospective evidence indicates and informs that people who are actively involved in helping in aspects of research, or help researchers or investigators with the design and other parts of process, have a much greater understanding of health and well-being. To provide a sort of broad understanding of some of the research activities, the RPSG have supported and coordinated some of the as have supported and coordinated as have supported and coordinated the some the some of these early sort of works, collaborations and projects. So promoting awareness and use of an electronic patient record, which had been referred to as renal patient view, but now referred to as patient view, to access for healthcare service users to access their investi- their investigations, their renal investigations online, and works through NHS Kidney Care, survey support for through organisation the Renal Information Exchange Group, or RIXG, some early works in context of solid organ transplantation with the National Kidney Federation, NKF UK. Kidney Health works with Kidney Health UK, supporting some works in regard to involve patients in renal video based projects, supporting a renal project in collaboration with and with collaborators at the university, one of the one academic institution in the UK, being one academic institution in the United Kingdom, and then supporting another sort of second sort of renal kidney based project or renal project, with academics and investigators in a second academic institution in the United Kingdom. Survey support looking at efficacy and safety of prescribing in transplantation. An organization that abbreviated as Aspirate, supporting a record access initiative with the Royal College of General Practitioners, or RCGP, works in around survey support for the Picker Institute in the United Kingdom, and survey support for mixed methodology services. The RPSG activities have continued, and the administration and research team are always and have always been open to supporting projects and collaborations. And then, as part of this research poster presentation, a little bit in regard to in regard to in regard to some of the media attention that the RPSG has had. Um, so in the time the RPSG had been conceptualized, co-founders have also prompted and been involved in several activities and supported renal disease awareness, and these have been captured to gain media attention. Some activities have included World Kidney Day and renal awareness, a local newspaper, in around 2011, a local newspaper in around 2011 from the southwest UK. We're looking at also sort of Will Kidney and solid organ transplantation discussion on a Southwest UK radio station in 2011. 2011, a Skype and Will Kidney Day e-seminars in around 2011, 2012. Collaborative bowling day and coffee morning event to raise CKD awareness in 2012. 2012 works collaborations with the National Kidney Federation (NKF), and when there was a sort of a link with a Kidney Life newsletter in 2012. Excuse me. Also also where there was a sort of picnic and fun day collaboration in 2012, which had had some media, where there was some media grounding, and there was a collaborative efforts also between the RPSG and an organization known as Misha's Hope, from a collaboration in 2013, and 2013, where there was some online online sort of media based attention, and then excuse me, and also some media attention in regards to looking at hemodialysis access and safety awareness in around 2013. And the RPSG was also a formal collaborator for the Lord Mayor in the Lord Mayor of and within the southwest region of the United Kingdom in around 2013, 2014. And was involved in raising further CKD, chronic kidney disease, and organ transplantation awareness through two local radio stations, two local stations, one being BCFM, and the second being Ujima radio stations in the southwest in the United Kingdom. And the RPSG was also involved at a film and within a film fiesta which took place in the southwest region in southwest region of the United Kingdom in 2014. The RPSG has had a varying representations in across seminars and within seminar and sort of conference remits. It has been important that the full range of people affected by healthcare by affected by healthcare, and have opportunities to get to be involved in and influence awareness and aspects of healthcare research, including people and groups who may feel they do not often have opportunities, sometimes referred to as marginalized or seldom heard, or people who feel overlooked or ignored by mainstream society. In this regard, a broad majority RPSG members have become more empowered to drive changes around chronic kidney disease (CKD) and relating or regarding healthcare issues in amongst their own ways. Using social media has prompted co-founders and founders and members of the administrative and research team to highlight activities at various and through varying platforms. These include some have included the some have included excellence in pediatrics, excellence in pediatrics, and excellence in pediatrics, the pediatric nephrology, the pediatric sorry the pediatric a pediatric nursing association, a Westminster Health Forum at the House of Commons, an EHI a remit within the EHI Live, within EHI Live, a and amongst and within and also within healthcare and IT national conference, healthcare and IT national conference, and remit within the European Working Group on the psychosocial aspects of children with chronic renal failure, and within the remit looking at through and through the remit of the European Society of Pediatric Nephrology, European Society of Pediatric Nephrology, and these remits of or sort of where representation has excuse me has formed are just a few of the remits that the RPSG has had some has had representation in around representation. The poster presentation then highlights some of the some of the collaborative some of the collaborative works in some more detail. So all healthcare professionals and researchers or investigators who have been intrigued to know and understand what makes healthcare practice better, and also sought to identify sort of better ways to inviting healthcare service users, patients through and within through and in sort of in aspects of research or research works, and whether actively designing, for example, studies or recruiting and following up recipients or patients, or analyzing data for publication. All investigators recognize the need or the requirement for new knowledge and understanding to guide achievement to guide practice to guide practice to achieve. The RPSG have been active on and through academic and professional collaborations. So the in addition to RPSG representation at varying seminar remits, for example, some of the RPSG academic and professional collaborations have included, for example, RPSG and the multi faith forum, a multi-faith forum within the southwest region of the UK, a newsletter publication in around 2014, a research grant, a grant collaboration in around 2013 and 14, in collaboration uh, um, with um, with a sort of primitive collaboration, a primitive collaboration at the time, within two academic institutions, the RPSG, and an academic institution, and one academic institution, had a collaboration and formed a collaboration to publish sorry to develop a book chapter collaboration on the use of social media in renal care for a remit referred to as the EDTNA and ERCA, wherein this formed as part of the nephrology handbook in 2014. And there was a collaboration between a an academic institution in the London region, London region of the United Kingdom, and a collaborative effort, a collaboration with a team in Canada, on works and poster works, on pa- on sorry on a in regard to a paper, a publication and poster collaboration in looking at aspects of chronic illness and well-being in around 2014. And there had been a collaboration between the RPSG, and a collaboration between the RPSG and another academic institution in the London region of the United Kingdom, and a second academic institution in the United Kingdom, within the United Kingdom, on works looking at the importance of point of care testing, in importance of point of care testing, or POCT, in 2014. And the RPSG also excuse me, the RPSG also developed developed a collaboration, or had a collaboration in regard to with the Renal Information Exchange Group, or RIXG, on data, again on data where there was a data collection collaboration investigating how healthcare service users would like to receive important healthcare information, in around how healthcare service users would like to receive important healthcare information in around 2014. And and in addition, RPSG is now, and supported researchers with works in regard to particular and specific clinical trials for clinical teams, for clinical teams in amongst pediatrics and young people suffering with forms of chronic kidney disease. And hence in this, as part of this particular collaboration, the RPSG equivalent, the Kidney Disease and Renal Support Group for Kids, or KDARS group for kids, had also and were the primary were the were the primary sort of collaborators in amongst this particular works, in as much as where clinical trialists were signposted to the KDAR's social media platform. So, in regard to sort of some of the reflections, at least between 2009 and 2014, and obviously, listeners, we're now looking at 2024, so a decade on further, um, at least where the RPSG is concerned. Between 2000 and 2009, 2014, RPSG has informed had informed the following as part of the research poster presentation. The most challenging periods of duration for the RPSG was the initiation, when co-founders did not anticipate that the platform will, for example, get past 10 members. In May 2013, the RPSG team implemented a small poll asking members would they prefer to have the platform open or closed. 52% selected the option closed, and 39% selected open. As a result, the RPSG had been a closed sort of group or platform, social media platform for have been a closed social media platform since, which provides a confidence for members to discuss sensitive topics without non-group members viewing comments. The RPSG is now past its fifth year. But in context of as part of this research poster presentation, the RPSG was into its fifth year, with an increase in international global membership, with patients, carers, and professionals and investigators from various institutions, gaining more understanding of raising CKD awareness and research for the broader world, which has become increasingly pivotal. The RPSG has provided also a sort of space or place for people, making it an informative sort of space or platform for healthcare service users, and through the platform have healthcare service users and healthcare service users and healthcare service users and carers, for example, have become empowered to make more formal healthcare decisions. In addition, the RPSG has provided opportunities that are supportive and representative of mutual intrigues, re, uh, and so it is, and so at the same time, excuse me, the RPSG is also it is and has also been a specific example of what has been referred to in the literature as participatory medicine, as described by works or within works, from one author in around 2014. So, the aim of this research poster presentation from 2014, 2015 was to provide an understanding of how the RPSG, number one, raises CKD awareness, two, supports healthcare professionals and researchers, and three, provide a reflection on the first 5 years between 2009 and 2014 in support of World Kidney Day 2000 and 2015. All so, sorry, social media excuse me, social media platforms are becoming or have become a more broadly utilized as almost sort of the first ports of call for information and potential for information, and also for potential for potential aspects in regard to and research collaborations in context of where there are mutual objectives between investigators and healthcare service users. Whilst professionals have become whilst professionals or healthcare professionals and investigators have also become sort of members in around the RPSD, they are not and have not been sort of active, and this is an element that RPSG founders would like to see develop further. The RPSG continues to raise awareness and provide opportunities for members to actively interact and get involved through its social media platform. Since this research posed the presentation, listeners, there have been several additional social media platforms that the RPSG streams across, and the 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 so although there is sort of developed guidelines or guidance in regards to the use of social media, which was published by NIHR, National Institute of Health Research, NIHR, involving in around 2014. Intriguingly, RPSG founders and co-founders had found that found that 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 had found supporting research and collaborations since the group was have been sorry have been supporting research and collaborations or collaborative efforts since in around 2009. And whilst there is some research highlighting a time and effort it takes to organize a well-moderated social media platform, and how a team administers and supports research, it is with thanks to RPSG administrative and researchers, and members that founders and co-founders have found the first initial 5 years, again between 2009 and 2014, 2014 fulfilling. And the RPSG is a group or a platform that is and has quite literally been a place where awareness and research meet. That draws this audio podcast to a close. This audio podcast as part of a quantum edition. This audio podcast as part of a Vortux Gauntlet, an audio podcast as part of a Lobostic sequence, an audio podcast as part of a Storm Lobostics production.